Hi, Samuel Muthoka. Thank you very much for giving us a bit of your time today. Um, on African Things, we will be talking about the new normal in Kenya following the decision by the US government to defund 72 out of 82 USAID funded projects in Kenya. Most of these, I understand, is in the healthcare sector. Over 150 clinics integrated with routine healthcare services have been shut down. 54,000 jobs in healthcare sector alone instantly lost, raised to nearly 1.4 million direct beneficiaries of USAID funded for HIV/AIDS ART, antiretroviral therapy or ART due to disruption of supply chains, among other challenges that are on the ground. You are in Kenya. Your organization Ipsos deals with data, raw data, and you interpret it as such. But my question to you is, tell me the realities on the ground following the decision by the US government to pull USAID funded project in Kenya.
Thank you very much, Peter. And like you rightfully put it at the beginning, the new normal, because we are at that stage where probably do not expect things to get better, but we are in that situation where building resilience and we're looking for alternatives and ways of coping with the realities on the ground would be the new normal and the new way of African countries to survive, and especially African countries that relied heavily on donor support and especially from the USAID. But just to put it in perspective, and like you put the numbers very, very clearly, today I came across a newspaper publication, a daily publication in Kenya, which put in a very grim figure of the recurrence of HIV and AIDS, looking at infections going up to 10%, 18% in some counties like Nairobi. Talking of 30,000 new infections in the county of Nakuru. Talking of an increase in newborn HIV cases that has never been witnessed in the arid county in northern Kenya, something that has never been reported before. So another new normal that we are facing is all the gains that Kenya had gotten in terms of reducing infection and severe disease seem to have been erased quickly. And the new normal right now will be a disease burden and the ripple effect that comes as a result of reduced the ARVs, the heart treatment, the reduced workforce, and such. And I know this is not a situation that affects Kenya alone. I know this is a situation that affects many other African countries, and especially where the programming in healthcare was heavily supported by USAID. We are also looking at other aspects, of people's lives that are affected in the education and literacy, higher education, training and development, private sector reforms, building resilience in communities, agriculture and food security, environmental management, electoral governance. So the USAID was a very strong supporter of democratic institutions or building democracy, and especially in Africa. And without that support, needless to say, we are seeing some of the effects and the impact in, because democracy has a long way to get developed in many parts of Africa. So whatever gains that had been made will definitely be eroded. Issues around social inclusion, disability, gender mainstreaming, building of public institutions. Without that critical support, we will see a lot of gains that had been made being eroded. And the reason why I talk about this is because the resource mobilization and funding from African governments will come in, but it can only go as far as not so much. So there's that very big gap that still exists. And most importantly is asking the big question, how do then African countries reorganize themselves so that there is social support and especially development that builds resilience right now in the absence of USAID. Some governments have come out very, very strongly saying that, we did not have to depend on donor support all our lives, putting up very strong health institutions, putting up very strong health policies. And it is important to note that the government directive in Kenya, for instance, that has encouraged millions and millions of citizens to register on the social health platform, a social health scheme that is funded by taxpayers and managed by the Social Health Authority, is an avenue that is bringing the much needed healthcare support to millions of Kenyans who were excluded. And as much as the funding and the resourcing is well used, then there is a massive impact. And this is critically very, very important because we are also seeing the advent and the rise of cardiometabolic diseases and lifestyle kind of diseases that require heavy investment and that pose bigger disease burdens to families. We are also seeing a lot of corporates stepping up, and this is something that we laud. Many corporates coming up strongly through their foundations, and through these foundations passing on millions of dollars to support a lot of the initiatives that were left orphaned by USAID. Local corporates, but most importantly, we are also looking at the global foundations that have come out very, very strongly in terms of supporting infrastructure, supporting programs that alleviate, the most disadvantaged societies. Please allow me to mention with a lot of respect the work that we are seeing coming out of the Gates Foundation in Africa, the work that we are seeing coming from a MasterCard Foundation, the Global Alliance for Vaccine Initiative, Gavi. We have seen UN organizations stepping up. We are seeing a lot of the zero-dose immunization of zero-dose communities that's driven by UNICEF. We are seeing the World Bank coming in very, very strongly in the business and enterprise space, but also in agriculture and food security. We're seeing organizations like the Global Alliance for Nutrition, GAIN, coming out very, very strongly to increase their funding to extending nutrition services to less fortunate in societies. We are seeing organizations like the European Bank for Reconstruction and Development stepping in a strong way, and especially to address the gaps in the climate mitigations and climate innovation. And this is a great way of saying that, yes, USAID may have stepped out, but there's a lot of organizations that are stepping up. And because of that, there's a creation of continuity that is happening. But I have one
I'm not cutting you
critical
short,
question.
Samuel. I'm not cutting you short, Samuel. But the question then becomes: are these efforts sustainable? Because in the long run, once bitten, twice shy, Africans would say, will there resilience being built could match or surpass what was gotten before as part of the effort to cushion the effect of what has been done following the decision by USAID to pull out? And the talking about resilience, I know the governments have stepped up. They are saying we cannot rely on foreign handouts forever, but obviously other international bodies are also helping. So building resilience and ensuring that they are able to stand on their own 2 feet in the next few years, others say should be what the government should be focused on. Your thoughts?
Peter, in my view, it will take the next decade, one whole decade, for governments to stand on their feet and say that we moved on. And that one decade will be filled with a lot of human suffering because the kind of resources that will be mobilized will never be enough it will not be anywhere matching what USAID was doing. And for example, let me give you a very big gap. For instance, USAID was a strong supporter of what we call monitoring, learning, research, and evaluation. And especially, for instance, USAID supported the large health surveys that used to happen in Africa, budget surveys, surveys that would tell how countries are managing the budgets and the health of its people. We do not have anybody doing that. So even in many instances, it will be very difficult to measure some of the impacts that these governments are doing. And remember, this was a large scale. It was scale work done across many countries. You could tell where we could easily direct aid, where we could easily direct a lot of the assistance. But without that kind of an investment, there will be a lot of groping in the dark. And some of the needs in the societies are huge. It will take, in my estimation, a decade to be able to say, now we can stand on our feet, now we are moving. On condition that there is tidying up in terms of resource mobilization, but also resource use, prudent use of the resources that are available. Then we need almost a whole decade to plan and be able to say that we are now stable.
So the question now, Samuel, is let's look at the new alternatives for business sustainability following this decision. Where do countries go from here, starting from Kenya and in the region and across Africa?
A sustainability agenda must be discussed in all boardrooms, must be discussed in all institutions, must be discussed even at household levels. And sustainable development is what we need. Please allow me to issue my personal criticism of what, the old world order, if I may call it that way.
Right.
There was a lot of funding that would be given, but there would be no strong measures to ensure that there will be sustainability. And so right now, every single resource that is being put on the table, every single mobilization has that agenda at the forefront. How do we sustain this moving forward? And this requires a lot of mobilization. This requires having a lot of consultations and working with all hands on the deck. Countries and businesses right now need to look beyond the old ways of doing business. For instance, climate finance right now is a big area that has come, that is creating a lot of sustainable avenues, not only for countries, but for businesses. And when we talk about this aspect of climate finance, we are looking at nature-based investments that can actually increase outputs of businesses, where you look at what is naturally viable, a nature-based solution that is viable to your business, and you pursue it. We're looking at climate smart initiatives. We're looking at initiatives that, for example, reduce carbon emissions, reduce use of paper in businesses, in government offices, where there's renewable energy being put in place, and thus reducing the need for fossil fuels. We're looking at alignment with climate and weather patterns across countries, so that we can increase, food production, so that we stop relying on, the old technologies where if weather fails, then there's no food, and the ripple effect is very, very, very wide. So coming up with such kind of approaches, climate smart agriculture across countries, and then in building this in the strategies, not only at government level, but at almost up to community level, up to household level, ensuring that whatever we're doing is smart, it can adapt to the climate change that we are seeing. So that is a very big aspect of innovation, and those innovations exist, and climate smart financing options are already available and can be tapped by businesses. So that is a big avenue for sustainability. But then, more importantly, and a cardinal to this conversation, is that the grass outside there sometimes tends to look very green, and it can actually be very green. And you'll find that a lot of domestic markets are very saturated. Trying to expand businesses in domestic markets becomes very, almost a difficult. You are likely to get much more dollars, and so looking at where else. And let me give my hypothesis why we need to look out there in what I'm calling frontiers. Frontier markets tend to evoke a lot of feelings and perceptions because they are seen as, that place is very insecure, human beings don't exist. That place has a lot of corruption, that place has a lot of hurdles, that place has but you go to these countries that we call frontier countries and you find there are brands that thrive there in a big way, not survive, thrive. And you need a good strategy and a plan. And then you get into frontier market and find that you have ideas and products and goods that can actually find a domicile in those markets. And so exploring and navigating frontier markets, of course, they have a lot of challenges. You need to understand cultures across, people's ways of doing things, how governments organize businesses in such countries, what are the requirements, so that you can actually extend beyond your comfort zone and then create new avenues for revenue streams that can cushion the business in the event there are shrinkages or in the event there are shocks in the domestic markets.
Now, let's look at developing a data driven culture because, as you know, a lot of African countries do not have that kind of culture. Data, which most people use for all kinds of things that could even influence policy directions or policy being embarked upon by governments, sometimes are a bit wobbly. So, how do Africans begin this process to have this, you know, culture of data, gathering data for their own people in order to plan effectively and ensure that their policies are effective on the ground?
Peter, in my 20 years as a researcher, having researched actually all the 54 countries in the African continent, I have not seen one fear that engulfs governments, such as the fear of data, the fear of evidence, the fear of the truth. But we must say that what we call the developed world has actually developed because decisions are based on evidence, on facts, on statistics, and on trends. And it is high time that we encouraged governments and businesses to invest in data because data driven decision making gives you an advantage, it gives you an edge. You are able to escape a lot of errors, you are able to mitigate a lot of disasters when you have facts before you put any investment on the table. And so it is very, very important that businesses and governments in Africa invest in a data-driven culture. We have a lot of ideas. We have borrowed a lot of ideas from our colonial masters. Sometimes we just bring and assume that the shoe fits. We do not even test those ideas to find whether they are culture fair, whether they are cultural shocks, or whether they apply in our kind of geography. And I always give, a very good example of, say, medical beds. We have great medical beds that are made, for instance, say, Germany, and they are imported into Africa. And they come into Africa, a country like Nairobi, where humidity is ever very high, where the vagaries of nature will erode that bed within a couple of months. It was never built for a humidity of a place like Nairobi. It was never built for a place where it will wear and tear A bed in our public hospital will accommodate 4 or 5 people, not because of anything, but that is a situation of need that we are in. It was never built for 4 or 5 people. It was built for one person. So when you go to our our yard where we keep, the boneyard, you will find so many of equipment that cannot be used because they just lack, a small component that takes ages to procure from a different continent. If we tested these ideas locally, you would easily do a very good design, human-centered approach, a very good design of products that fit in our geographies, in our climates. Sometimes we just take and just implement without even testing. Sometimes we have a lot of things, a lot of programs that have been done, and we need to measure the impact of those programs. We need to find out whether they fitted the bill for which they were created for. We need to know whether they created real, tangible impact that can be shown by evidence. We need to see the communities that have been affected and write those stories, document those stories. We need also to learn from experiences of others. And if that is not shared, is not documented, then capacity building becomes a real joke. Reading and documenting those research. We need to apply technology. Technology has become a very important aspect in accelerating the monitoring, evaluation, and learning space. And this will not come if you do not have budgets for monitoring, evaluation, research, and learning. And that is a very important component that I would encourage governments in Africa, businesses in Africa, institutions in Africa to have in place, because in that way we shall develop a data-driven culture where any simple investment, any simple decision that is done is based on facts, is based on evidence. And then you shall see real sustainability. Because unfortunately what happens most of the times is groping in the dark, and then we make a gut felt decision and the boss decides and we go that route. And if you deviate, you get sacked, you get a fire, all that. But if we have data driven decisions, then we can have some safety and we can have investors who come because we have entrenched that as part of our daily living, our whole way of doing things.
Thank you very much, Samuel Muthoka, for speaking to us here on African Things. We look forward to having more of this discussion as things unfold from here. But we look forward to having you soon, Samuel Muthoka. We thank you very much for giving us a bit of your time today. Thank you.
Thank you very much, Peter.